Navigate the complex world of hypertension, a health condition affecting nearly 1 billion people globally. When we talk about hypertension, we're referring to a persistent state of high blood pressure. Imagine your arteries as tiny hoses, and the blood coursing through them as water. Now, if the pressure in those hoses is consistently too high, that's what we call hypertension. A quick glance at the numbers reveals that hypertension isn't a minor problem. It's a global health concern. The World Health Organization estimates that nearly 1 billion people worldwide have high blood pressure. In the United States alone, about 1 in 3 adults live with this condition. That's roughly 75 million American adults waking up every day to navigate life with hypertension. But what is blood pressure exactly? Well, it's the force exerted by your blood against the walls of your blood vessels. Every time your heart beats, it pumps blood into these vessels, resulting in pressure. Normal blood pressure keeps everything running smoothly, like oil in a well-tuned engine. But high blood pressure? That's like turning up the pressure in a fire hose. Eventually, something's gotta give. Hypertension is often dubbed as the silent killer. Why? Because it typically has no clear symptoms and can lead to severe complications if left unchecked. It's a key risk factor for heart disease and stroke, 2 of the leading causes of death worldwide. But there's good news. Despite its widespread prevalence and potential severity, hypertension is manageable. It's not an automatic death sentence or guarantee of poor health. With the right knowledge and tools, it's possible to live a normal, healthy life with high blood pressure. Understanding hypertension can help manage it effectively and reduce its impact on your life. Uncover the mysteries behind the causes and symptoms of hypertension. Let's dive into the complex world of hypertension, a condition that impacts millions worldwide. Hypertension or high blood pressure is a multifaceted health issue with various potential causes. These can be divided into 3 main categories: lifestyle factors, genetic predisposition, and environmental influences. Lifestyle factors are perhaps the most impactful and, fortunately, the most controllable. Unhealthy habits such as excessive salt intake, lack of physical activity, obesity, smoking, and excessive alcohol consumption can all contribute to hypertension. It's a classic case of how our daily choices can directly influence our health. Genetic predisposition is another significant factor. If your parents or close relatives have hypertension, you might be genetically predisposed to developing the condition. It's like a secret code written in your DNA, waiting to be triggered by certain factors. Lastly, we have environmental influences. Chronic stress, whether from work or personal issues, can raise your blood pressure levels over time. Even exposure to long-term noise pollution has been linked to hypertension. It's a stark reminder of how our surroundings can subtly yet significantly affect our health. Now let's talk about symptoms. Here's a surprising fact. Hypertension is often called the silent killer because it typically presents no symptoms until it becomes severe. That's right. You could have high blood pressure for years without knowing it. When symptoms do appear, they can range from headaches, shortness of breath, and nosebleeds to more severe complications like vision problems and chest pain. But remember, these symptoms usually occur when hypertension is already severe and causing damage to the body. Recognizing the causes and symptoms of hypertension is the first step towards managing this condition. But because of its silent nature, regular checkups are crucial to catch this condition early. Prevention and early detection are key. Knowledge is power, and understanding hypertension can empower us to make healthier choices and live better, longer lives. Explore how hypertension can affect your day-to-day life. Hypertension, often known as high blood pressure, is not just a mere medical condition. It's an unwelcome guest that can intrude on your daily life in subtle and not-so-subtle ways. Imagine you're an avid gardener, but you find yourself out of breath after just a few minutes of weeding. Or maybe you're a teacher who loves to engage with students, but you're constantly battling fatigue. Or perhaps you're a grandparent who wants to play with their grandchildren, but you're apprehensive about the strain it may put on your heart. These are just some of the ways hypertension can rob you of the joy of everyday activities. Work productivity can also be affected. Hypertension is often accompanied by headaches, vision problems, and bouts of fatigue. These symptoms can interfere with focus and concentration, leading to decreased performance. Imagine trying to meet a tight deadline while battling a throbbing headache or fighting off drowsiness. It's like trying to run a marathon with weights on your ankles. On a broader scale, hypertension can impact your overall quality of life. It may limit your ability to participate in physical activities, causing you to miss out on social events or hobbies that you once enjoyed. It can also lead to stress and anxiety about health complications, putting a dampener on your zest for life. Now let's add a human touch to these facts. Meet John, a 65-year-old retiree who loved hiking, but after being diagnosed with hypertension, he had to swap his hiking boots for slippers. He struggled with the new reality that the trails he used to conquer now seemed like insurmountable mountains. But John's story isn't unique. There are millions of people around the world grappling with similar challenges. In essence, hypertension can significantly impact your life. It can change the way you live, work, and play. It can steal moments of joy and replace them with worry and apprehension. But remember, understanding these impacts is the first step towards managing them. Hypertension can significantly impact your life, but understanding these impacts can help you manage them. Demystify the process of diagnosing and treating hypertension. Now let's talk about how hypertension is diagnosed and the various treatment options available. Hypertension or high blood pressure is often discovered during a standard medical checkup. A healthcare provider will use a device called a sphygmomanometer to measure your blood pressure. This device has a cuff that inflates around your arm and a gauge that reads the pressure. If your blood pressure is consistently high over multiple visits, you may be diagnosed with hypertension. Remember, one high reading doesn't necessarily mean you have hypertension. Our blood pressure can fluctuate throughout the day due to factors like stress, caffeine, and physical activity. Once diagnosed, a treatment plan tailored to your specific needs will be put in place. The goal of treatment is to lower your blood pressure to a healthy range and maintain it there, reducing your risk of complications like heart disease and stroke. Treatment usually begins with lifestyle changes. This might include a heart-healthy diet, regular physical activity, maintaining a healthy weight, limiting alcohol, and quitting smoking. These changes alone can have a significant impact on your blood pressure. If lifestyle changes aren't enough, medication may be required. There are several different types of blood pressure medications, and you may need more than one to control your blood pressure effectively. These can include diuretics, beta blockers, ACE inhibitors, and calcium channel blockers, among others. Your healthcare provider will work with you to find the best combination with the least side effects. Apart from conventional treatments, some people find alternative therapies helpful. These can include stress management techniques like meditation and deep breathing, as well as supplements such as omega-3 fatty acids, coenzyme Q10, and garlic. However, it's crucial to discuss these with your healthcare provider before starting any new regimen. With early diagnosis and appropriate treatment, hypertension can be managed effectively. So don't shy away from those regular checkups. They might just be the key to catching hypertension early and keeping you healthy for years to come. Discover practical tips and strategies to manage hypertension. Living with hypertension may seem daunting, but don't worry. There are many ways to effectively manage this condition and lead a healthy life. Let's explore some of them. A crucial part of managing hypertension lies in modifying your lifestyle. Think of it as remodeling your daily routine, with a focus on diet, physical activity, and stress management. When it comes to diet, prioritize heart-healthy foods. They say an apple a day keeps the doctor away, but the benefits of fruits and vegetables extend far beyond that catchy phrase. They are packed with nutrients and fiber that can help lower blood pressure. So, aim to fill half your plate with fruits and veggies at each meal. Also, limit the amount of salt in your diet. Too much sodium can raise your blood pressure. Try using herbs and spices to flavor your food instead of reaching for the salt shaker. Next on the list is physical activity. Regular exercise can significantly lower your blood pressure. You don't need to run a marathon, even brisk walking, cycling, or dancing can do the trick. Aim for at least 30 minutes of moderate activity most days of the week. Now let's talk about stress. It's a sneaky culprit that can wreak havoc on your blood pressure, so it's important to find healthy ways to relax and de-stress. It could be through meditation, yoga, reading, or even knitting. The key is to find what works best for you. Regular checkups are also essential. They allow your healthcare provider to monitor your blood pressure and adjust your treatment plan if necessary. Remember, hypertension is often a silent condition, so regular monitoring is vital. Lastly, if you're prescribed medication, take it as directed. Skipping doses or stopping medication without your doctor's approval can lead to complications, so there you have it. These are some practical strategies to manage hypertension. Remember, everyone's journey is unique. It's about finding what works best for you and sticking to it. Effective management of hypertension involves both medical treatment and lifestyle changes. Learn about products that can aid in the management of hypertension. As we navigate the world of hypertension, it's essential to mention the tools that can assist in managing this condition. One such tool is a home blood pressure monitor. These handy devices provide a way to keep tabs on your blood pressure levels in the comfort of your own home. They can be invaluable in identifying fluctuations and trends, facilitating conversations with your healthcare provider. There are many models of home blood pressure monitors available, and they come in different shapes and sizes, from wrist cuffs to upper arm cuffs. Some even have Bluetooth capabilities, allowing you to sync your readings to your smartphone. It's important to choose a monitor that is clinically validated for accuracy. Another beneficial product is a heart-healthy cookbook. Yes, you heard that right, a cookbook. Diet plays a significant role in managing hypertension, and a cookbook tailored to heart health can be a great guide. It can help you discover delicious, low-sodium recipes and inspire you to make healthier food choices. In addition to these, there are specific mobile applications designed to help manage hypertension. These apps can track your blood pressure readings, remind you to take your medication, and provide useful tips for lifestyle modifications. They are a convenient way to keep all your relevant information in one place. And let's not forget about fitness trackers. These devices can monitor your heart rate, track your physical activity, and even remind you to move if you've been inactive for too long. Regular physical activity is an integral part of managing hypertension, and a fitness tracker can keep you motivated. Just a quick note. While we're discussing these products, it's essential to clarify that we have no affiliations or sponsorships with any of them. The goal here is to provide you with information and options that can assist in managing hypertension. Remember, while these products can aid in managing hypertension, they should be used in conjunction with medical advice. Always consult your healthcare provider before making any changes to your treatment plan or introducing new tools into your routine. It's all about finding a balance and figuring out what works best for you. Hear from the experts on effective hypertension management. We've spoken to a number of healthcare professionals who have shared their knowledge on the subject. Cardiologist Dr. Anderson explains, hypertension is often referred to as the silent killer because it can go unnoticed. Regular checkups are crucial for early detection and management. Nutritionist Miss Lawson emphasizes, a balanced diet, low in salt and rich in fruits and vegetables, can significantly reduce hypertension risk. Physical therapist Mr. Parker advises, regular exercise, even light activities such as walking or gardening, can help lower blood pressure. Psychologist Dr. Reed adds, stress management techniques like meditation or deep breathing exercises can also contribute to maintaining healthy blood pressure levels. Pharmacist Ms. Rivera reminds us, always take prescribed medication as directed by your healthcare provider. Never adjust dosage or skip doses without consulting them first. Expert opinions can provide different perspectives and credible insights into hypertension. Address common queries about hypertension. Hypertension, also known as high blood pressure, raises a lot of questions. One frequently asked question is, what causes hypertension? The answer isn't always simple. It can be due to genetic factors, lifestyle choices like an unhealthy diet or lack of exercise, or underlying conditions like kidney disease. Another common question is, what are the symptoms of hypertension? Often, there are no obvious symptoms. That's why hypertension is often referred to as the silent killer. However, in some cases, severe hypertension can cause headaches, shortness of breath, or nosebleeds. People also ask, how can I manage hypertension? Lifestyle modifications are key. Eating a balanced diet, getting regular exercise, reducing sodium intake, and managing stress can all help control high blood pressure. Medication may also be necessary depending on the severity of the condition. Clearing misconceptions and providing accurate information helps in better management of hypertension. Discover where to find additional help and information about hypertension. Numerous support groups, both online and offline, are dedicated to helping individuals manage this condition. These communities provide a platform to share experiences, learn from others, and find encouragement. Additionally, resources like the American Heart Association's website offer extensive information and advice. Local healthcare providers also often have materials and classes to aid in understanding and controlling hypertension. Support and resources can make the journey of managing hypertension less daunting. To wrap things up, we've delved into the multifaceted world of hypertension, spanning from its causes and symptoms to the impact it has on daily life. We've explored various treatment options, lifestyle changes, and products that may aid in managing this condition. We've also provided resources and expert insights to further your understanding. But remember, managing hypertension is a journey, and it's crucial to consult healthcare professionals before trying any new treatments or products.